100% thing. So in this germline gene therapy, after you have certain
Kumari from Malaysia, renowned for her clinical expertise in autologous exosomes preparation and step-by-step protocols.
Dr. Widya Mars leading the framework of autologous exosome preconditioning in clinical practice.
Dr. Silvana Sartika Wangsa Wijaya MKK, expert in anti-inflammatory peptide-based preconditioning.
Dr. Srikant Sundaresh, PhD from India, consultant orthopedic surgeon and pain management expert.
We are honored.
We will have so many different things to explore with another knowledge and possibility to do for better opportunity. To find the root of cause, it's not possible to treat the sickness without knowing how is the hormone balancing, how to treat the nutritional deficiency, how to give our best lifestyle modification, stress management, how to change our sleeping habit, include how food become medicine, and how not to use some medication to prevent the side effect. And now, we are also being introduced with peptide, the new kids on the block that might change our perception to give the best therapy option of your patient. Peptide now is being so trendy globally, and I'm sure that you will be the first to become the pioneer to use all the things include peptide to our patient for their better quality of life. On behalf of our committee, Functional, Integrative, and Innovative Medicine, thank to all sponsors that already participate to succeed this incubator.
So, in this incubator, the one that we have actually curated has a cover system as well to ensure that the temperature inside of the tube remains the same. So just keep it there, don't shake it, don't open, don't play with it. So that will be, okay? So, do not disturb the tube during incubation. Micro vibration affects vesicle release, yeah? Because we are actually promoting them. So you have to not stress them, okay? Let them rest. Okay? So natural activation, you will create optimal regenerative extravesical profile. Okay? So why are we doing the incubation? I have given you the slide. I've also already told you. So it actually creates a mild hypothermia similar to low-grade fever or FIR sauna therapy. Why do we do this? I cannot heat you up, correct? Right? How do I heat you up? Put it in the microwave? No, right? So that's why we heat your blood up. Okay? So prior to the exosome, 1 week before, 3 to 5 days before, you are allowed to go for 5 infrared light sauna. It will actually help to release more good exosome into your system. Okay? So, heat shock protein will function as a chaperone. It will stabilize the protein, prevent misfolding, and improve cellular stress signaling. Yeah? Okay? So, exosome harvested after this breast stress are enriched in protective and regenerative cargo. So, you can do without the incubation. Somebody asked me. You can do without the incubation, but it is better with the incubation. Yeah? Okay? I think next. Yes, darling. So, we have already said the centrifugation. After you harvest the blood, number one, you harvest the blood, then you straight go into the incubation. From the incubation, you straight go into the centrifugation. From the centrifugation, only then we do the filtration. That's the fourth step, yeah? Cannot. Suka-suka. Okay, yes, correct. So, again, centrifugation is to isolate plasma from RBC, platelets, and white blood cell. Okay, the key point here is to use the correct G-force. Okay, and usually we do at 3,900 RPM and above, if it's possible. And we do it for how many minutes? Again, 30 minutes. If more, also can. If your patient have time, no problem. But the problem is going to be is in within 2 hours of your blood draw, you have to already use your exosome. Okay, we cannot keep it more than that. Okay, so if in case you're doing for hair transplant patient, you may want to actually prepare the whole exosome and keep it in the refrigerator, because in the refrigerator you can keep the exosome for at least 6 hours only, not more than that. So you have to complete doing the whole hair transplant as we do. I understand it's a very long period. It's a long process, 4 to 8 hours process. So hence, prepare it and keep it in the fridge and take out as you use them. Yes.
4 to 8?
Yeah, correct. 4 to 8 degrees. Your vaccine temperature.
RPM of more than 3,900. How about the G-force? What's the G-force?
Depends on, usually all the centrifugation machine has their own G-force. It's the G-force that we are actually looking at. Yeah. I will come back to you. Because most of the centrifugation machine today already has a G-force set up to it. Yes. Yeah. Okay, so balance rotor is critical. So what is happening? It is critical. We can just show it to you right now. Okay? Yes. The G-force will be around.
G-force is calculated depending on the diameter of the tube, weight of the tube, and RPM. So ideally we need a 5070 G-force. 5000 plus.
Depends because we are changing the tube vessel each time.
Yeah, so
Yes.
5000 plus G-force is a good force to.
We'll add that in the later, yeah? Okay? So, we get the point, yeah? So, balanced rotor is very critical. It has to be on a ground floor, which is not moving. So, when you put your exosome tubes inside of the centrifugation machine, that also you have to make sure it is balanced. If it's unbalanced, you can hear the machine is actually going haywire. Okay? Take it out back again, reposition it, and balance it. If you have lesser bottle, then use a mop bottle to just balance it back. Just fill some bottle with some liquid and balance it back. Is that okay? Yeah? Okay. So, next we go to filtration, like I said, is to actually isolate the supernatant or the plasma inside to remove microparticles. So, use protocol-specific filter, the filter that is given to us. Please do not use any of commercial produced filter because the filter may contain things that may create allergy reaction into your body. The filtration here is as the system of the filtration here doesn't create or doesn't produce anything that may cause allergy to your body. Acid pressure, later I'll actually show you the demonstration how to use the filter. So I have a few doctors, which is actually really funny. Okay, so when they're filtering, they see inside the filter there's balanced product, right, of exosome. They try to pull that out as well. So that is actually what we're separating, correct? So if you're pulling that back in, that means you're not filtering, right? So whatever is inside of the filtration system, let it be, correct? So don't push the pores in, push the pores out because the filter is very delicate. It is below 22 micrometer. Okay, it's very tiny pore. So if you push a very hard pressure into it, the filter pore will definitely bolos, bolos, yes. Okay, Indonesia is bolos.
Lolos.
Lolos. Malaysia is bolos. Indonesia lolos. In Philippines, puncture, breaks, tusuk. Yeah, rosak. So I'm making a joke out of it so we remember it, okay? Because while we are working with it, these are all crucial part of determining that you get exosome and nothing else. Okay? We are here to get exosome, correct? Correct. Good night. I'm so sorry, I'm boring. Okay. So remember, we need to get exosome, right? So if you're going to destroy the filter, you're not going to get exosome. Okay? You may get bigger particles than what we're supposed to get. So this is going to be a quiz. What is our exosome size?
50 to 70.
30 to?
50 to 70.
Okay, actually 30 to 100 is where we actually want to see the exosome in. Okay, so the filtration is 22. So you will definitely get something in between that only. But if you break the filter, then you just get plasma back again. Okay? Okay. So why filtration? Okay. So we want to remove the cellular debris, the apoptotic bodies, and the larger vesicles that cause inflammation. Okay. We want to ensure a cleaner exosome population, which is between 30 to 100 nanometers, like I said earlier. Reduces the chance of introducing pro-inflammatory byproducts of the patient into the system. Okay. Why double filtration for the IV? Why? So the same filtration, why we do it twice? Because first, filtration to remove larger debris, which is like cell fragments, fibrin, apoptotic bodies, and microvesicles, which is above than 200 nanometer. So when you do that, the filter, the first time, the filter will definitely break. Okay, so when you're going on the third tube or the fourth tube, the filtration is no longer that pure. That's why we give you double filtration. Okay, so the second filtration is to ensure removal of pyrogens, bacteria, and residual aggregates, because you're doing this for IV. Can you do PRP for IV? Please say no.
No.
Oh, so scary. No, you say no. So this is the reason why you cannot do PRP IV, okay? Because you may cause clots in the system. Yeah? So remember guys, when you're using exosome is different, when you're using PRP is different. Jangan salah now. Because udah shock guna exosome, you use PRP juga sebagai exosome. I'm warning ya. I've already stated. It's no, yeah? Okay? This is very important. That's why we're having a discussion. I'm not giving you a lecture. Okay? The next is, hence, IV always require the highest purity standard. We got that point? Oh yeah? So IV how many filter? I want loud. IV how many filter?
2.
No. IV how many filter?
Double.
Double. Oh my God. 2. IV how many filter? 2. Very good. So 2. 2. Okay, yes. Okay. So, this is okay, very important. Now we go to patient preparation protocol. Okay. There's no hardcore rules to this, but if you can actually follow it, it's better. But there's no hardcore rules to this, okay? So, fasting requirement usually is because we have already discussed about the hyperglycemic state. We did, right? So, what we're trying to say here is, try to fast more than 10 to 12 hours, 18 hours is better, 24 hours is even better, because you'll be releasing a lot of growth factors, okay? Plain water is allowed, okay? No supplements. If you have medication, depends on what medication you are taking. Okay, if it's really crucial for your hypertension or something like that, then it's okay, you can go for it. But if in case it's like other medication that you're taking on a daily basis, you can actually stop them for a bit. Or one day there's nothing going to happen. Seperti kamu lupa loh makan obat, right? It's something like you forgot to eat medicine. Okay, so you reduce lipemia, clean the plasma, higher purity. Okay, prevent cyclomicron contamination that interfere with centrifugation and filtration. Okay, so for IV therapy, avoid any IV infusion. So I know some of my friends are very smart. They say, hey, you know what, I don't need vitamin C. You know, the vitamin C in the plasma is, it will, signal more. No, you do not want to do that because you want it to be as natural to your body. Nothing's forcing out of your body. Okay? So, you have to drip within, no IV drips within 48 to 24 to 48 hours at least. Why? Because we can have an acute oxidative shift with vitamin C, especially vitamin C and glutathione, they always oppose each other because they're both very high in antioxidant. Okay, acute metabolic activation that will actually happen with carnitine and B complex. Okay, you may have mineral spikes like magnesium and zinc. You do not want that to be disrupting your exosomes. Okay, and then there may be changes in immune cell signaling. Okay, so dilutional effect on plasma protein 48 hours provide a stable baseline for the autologous exosome biogenesis process. Okay. So you want as natural as possible. All the preconditioning is done. Now, just trust your system in your body. Can we? Can ya? Okay. So, hydration. Okay, on the day of your exosome, okay, hydrate well the day before. Okay? If you hydrate so much on the day that you're taking exosome, now your plasma is going to be diluted. Do you want a diluted plasma? No, right? Okay. So, avoid overhydration on the morning of the procedure. That's very crucial, okay? And then, avoid these for 3 days before harvesting. Smoking, alcohol, high sugar meals, heavy exercise, sauna infrared, acute detox protocol, and very severe exercise like gym. If you're going for a walk, it's okay. But we do not want very heavy exercise. Yeah?
How about hyperbaric?
No, nothing. Don't disturb. Don't disturb the whole system. Just let it be. Okay? So why this create acute inflammatory exosome? Because your body will definitely want to fight it. Okay? So the day of the procedure, minimal stress. Somebody asked me, can they have sex or not? No, it's a legit question. Can you have sex?
Can.
Yes.
Is it relaxing or stressful for you?
It's good.
So it's a relaxing sex, maybe. But it's very stressful sex, please don't. Because I say avoid exercise. But this is a legit question. Yeah. Just person call you, okay, Jenna, I can have sex. I'm like, what? For what? And I said, oh, because I want to come and do exosome today. They're like, oh. Okay? So rest 10 minutes before your vein puncture. Okay? And avoid excessive water. Yeah, I told you that already. Okay? Thank you very much, guys. You're like exosome.
That is come. That means her exosomes are there. Her microvessels, the inflammatory part, what we were talking about, the microvessels and all are very less. Okay. So you see, it all came up.
I checked my insulin.
Microvesicles,
My fasting insulin is 5.
very good. And the apoptotic bodies are
Jadi
very
nggak boleh
less. So she's
bohong.
actually in the anti-aging.
Nggak boleh bohong.
This, so you see the serum, you see the you see the color. Whereas Dr. Catherine
Jadi
has a
Catherine.
lot of inflammation and autoimmune.
Jadi nggak boleh
Yeah,
bohong
and
di
now you
sini.
see everything is trapped inside.
Jadi nggak
It's
boleh
not
bohong
allowing it
dok.
to come
Buat
up.
diri sendiri nggak boleh bohong.
Everything is trapped in.
Nanti dia kelihatan di
So
situ.
that means the gel is working, is doing its job.
Mana?
The gel allows, I said, only the smaller particles to come up. So she has a lot of bigger particles in the body. Come, Dr. Catherine.
Because I don't have any more kit already. So what I can do here is I can just send, I can get to you in the morning for you. I'll get you. I'll just get you.
Catherine, Nurse Catherine, my information is less than
After a week or 10 days, you can
Dr.
take it
Vidya,
up
who's
and start
the
the
knee,
preconditioning properly.
the knee,
So when
my
you
mom
have
and
the
tolong panggil
smaller
dokter dalam
exosomes
mamanya.
produce more and the larger apoptotic
My mom,
bodies
my mom.
and this envelope that we
Tolong
talked
panggil.
about. Remember the first slide?
Gengnya Dr. Sri.
That is a lot in here. So that's why it's not allowing it to go. The gel will not allow it to go.
So we
Already
cannot
did.
lie. We cannot lie to the result.
So hardly any, you see, hardly any gel is there. Hardly any.
Does the whiskey water help with inflammation?
and now that
Good whiskey will always have.
Jadi abis dia ni ya, kasih dia punya apa, kamu guna nomor